This is Elitech, which is the brand name for rasburicase, and rasburicase is just the pharmaceutical form of the enzyme urate oxidase. In a previous video, I mentioned high levels of uric acid in the blood can cause gout, but it's important to specify moderately elevated levels of uric acid in the blood over a long period of time can increase your risk of developing gout. There's another condition called tumor lysis syndrome, where cancer patients are undergoing chemotherapy, and that chemotherapy is killing off cancer cells pretty quickly, so the contents of those cancer cells are spilling into the blood, and some of the breakdown products of those contents, specifically with DNA, is causing a very quick and sharp elevation of uric acid in the blood. Remember, DNA is made up of 4 nucleotide base pairs. There's adenine, thymine, guanine, and cytosine, ATCG. So when chemotherapy is killing cancer cells, and the DNA in those cancer cells is being broken down and spilled into the bloodstream, ATCG is what makes up that DNA, so those are the breakdown products in the blood. Adenine and guanine are the purines, and purines get broken down into uric acid. Imagine a big wave of uric acid crystals slicing up your blood vessels and trying to make their way out of your kidneys. Tumor lysis syndrome is really serious. So fortunately, this is where rasburicase comes in. Humans don't typically have this urate oxidase enzyme, so we don't typically convert uric acid to this allantoin, which is much less painful and easier to pee out than the uric acid crystals. So we just give an IV push of rasburicase and we monitor the uric acid levels and watch them decrease. Also, fun fact, allantoin is an over-the-counter medication that's formulated in skincare products to help heal scar tissue, so that's pretty cool. And good news for people who need a better treatment for gout, this is Crystexxa, which is the brand name for pegloticase, and just like rasburicase, this is also the urate enzyme, except Elitech is 1.5 grams per milliliter, this is 8 milligrams per milliliter, and this can be given every 2 weeks for chronic therapy of gout, and it can be given as monotherapy. And it can also be used alongside methotrexate, which is an immunomodulator that can help to dampen some of the inflammatory processes that come with an arthritis like gout. And methotrexate can also be used as a chemotherapy. Wait a second.